I'm the Strategic Advisor at AGRIP, and I want to welcome you to our HIPAA compliance webinar. A very, unfortunately, very important topic, although not all that interesting, but I trust that not all that exciting, I should say, but I trust that our panelists are going to impart lots of good information to us and help us prepare for what's coming down the pike from our beloved Department of Health and Human Services as they begin phase 2 of their audit program this fall. Let me very quickly introduce our two speakers, and then I'm going to turn it over to them. They have a tremendous amount of experience, and they have a tremendous amount of information to share with you. I know that Jessica has sent out to everybody who had registered the materials as well, so you'll have them after the webinar. But we're going to try to get through it as efficiently as we can. And just to remind you, there is a place to ask questions. What we like to do is take your written questions, you put them in, type them in as we go along on the toolbar, and we will hold them to the end. And then I'll sort of group them up and manage the process of facilitating the panelists answering the questions as long as we have time to do that. If there are any questions we don't have time to answer, we will try to get back to you after the webinar. So again, welcome to our webinar. I'd like to first introduce Petula Workman, who is a compliance counsel with Arthur J. Gallagher. Petula has become a real friend of AGRIP's over the past year and a half, helping us with a number of the compliance type webinars and trainings that we've been doing with the advent of the ADA. She's a graduate of the University of Texas in Austin, and if you read her bio, you're going to see so many acronyms that you probably can't even keep up with them all. But we know her to be a real expert in legislative matters, all related to health care and benefits, and as I said, she's become a real expert on governmental employer groups and has willingly volunteered her time both through these webinars, through our health plan resource group, and in some of our conferences. So welcome to Petula. And I'd also like to introduce Jeff Beauchamp. Jeff is general counsel for one of our members, the Delaware Valley Health Trust, which is the oldest and largest public entity benefits pool in Pennsylvania. They offer 250 different health plans, so they have their hands full there for the 17,000 plus covered lives that they take care of. I tapped Jeff a couple years ago to be the chair of the AGRIP Health Pool Resource Group, which works with us and some other volunteers from the pooling community to assess the impact of the new health care law on our members throughout the country. And that group has been very active and very helpful over the course of the past 2 years, and I'm sure we'll be continuing to lean on them as we go along. I also want to note that Jeff was awarded the AGRIP Excellence in Service Award this past spring as testament to the great work that he's provided in keeping our membership and pools across the country on top of things related to the ACA. So with that, I'd like to turn it over to Jeff.
Thank you, Jenny. First, let me give you an overview real briefly. We're going to walk through sort of like the big picture, so we're all on the same page as to certain terms. And then we're going to dive a little deeper into the 3 audit areas: privacy, security, and breach notification. And finally, we'll walk through the current audit protocols with the understanding that those protocols are slated to be updated for recent changes. We'll also focus on pools and the impact of HIPAA compliance on pools as well. These regulations were passed as part of HIPAA, which is the long form, the Health Insurance Portability and Accountability Act of 1996, real mouthful, later amended in 2009 by the HITECH Act. The privacy regs require covered entities and business associates to follow certain rules when handling and securing certain health information called protected health information, or PHI. These regulations establish a national set of security standards for protecting PHI held or transferred in electronic form. The breach regulations address impermissible uses or disclosures under the privacy rule that compromise the security or privacy of PHI, such that the use or disclosure of that information poses a significant risk of financial, reputational, or other harm to an affected individual. Covered entities. They include health plans, healthcare clearinghouses, and healthcare providers. Clearinghouses simply convert paper health claims into electronic health claims, whereas healthcare providers are just like they sound: doctors, nurses, hospitals, clinics, etc. Health plans are a bit trickier because they include not only medical plans, but HMOs, insurance carriers, dental plans, vision plans, healthcare FSAs, and any wellness programs. Many employee assistance programs, or EAPs, and long-term healthcare coverage. A business associate is a person who, on behalf of a covered entity, such as a health plan, uses, accesses, or rediscloses PHI either to perform or assist in the performance of a plan function or provide services to a covered entity. One of the most critical elements in HIPAA compliance is understanding what is PHI. So let's quickly take a look at the definition. Protected health information is individually identified health information which is created or received by a covered entity and relates to the past, present, or future physical or mental health of an individual, or the provision or payment of health care for an individual. It applies to information in any format, be it paper, electronic, or oral. With that in mind, let's run through a few quick examples of PHI. Enrollment information maintained by the plan is PHI, and so is a list of member names with Social Security numbers and aggregate claim dollar amounts. A list of members choosing continuation coverage is also considered to be PHI, as is an email with claim information for a specific member. It's also important to know what is not PHI. PHI does not include enrollment information in the hands of employers. That'll be further explained later in our presentation. It also does not include information related to an employer's obligations to administer laws such as the FMLA, Family and Medical Leave Act, and the Americans with Disabilities Act or similar state laws. It lastly does not include records related to occupational injuries, disability insurance eligibility, or fitness for duty exams, while that information is in the hands of an employer. With these basics in mind, let's turn to the reason for our discussion today. The act I mentioned that amended HIPAA is called HITECH, and it requires HHS to provide for periodic audits to ensure covered entities and business associates are complying with the HIPAA privacy and security rules and breach notification standards. The office within HHS that oversees the HIPAA privacy and security is called the Office of Civil Rights, or OCR. They developed a pilot program between November 2011 and December 2012 that sought to determine how well covered entities comply with HIPAA privacy, security, and breach notification requirements. These are referred to as Phase 1 audits. During 2013, OCR evaluated the information obtained during the audits and provided final reports to those involved in the audit pilot program. 2014 marks the dawn of a broader scale audit program, which will include business associates as well as covered entities, and is referred to as Phase 2. Before the creation of the audit program, OCR had only had a compliant-driven audit process that is called the compliance review, and it's only triggered by a complaint. An audit during a compliance review is more limited in scope than an audit under the new program, and generally only focuses on the requirements that were in question during the compliance. However, compliance reviews can lead to substantial multi-million-dollar fines, so they are best avoided, to say the least. The new audit program is not compliant-driven. This illustration shows OCR's planned timeline for an audit. In reality, the audits during the pilot program took much longer, with final reports issued several months after the on-site audit occurred. And these are called Phase 1 audits. Phase 2 audits is more streamlined and does not include an on-site visit. However, like the Phase 1 audit program, the process starts with a notice and data request. Respondents will have 2 weeks to provide documentation. The auditors will conduct a desk audit, meaning that they will simply review the documentation provided. The covered entity will then receive a draft finding for review, and once any comments are received, a final report will be issued. So what's the new audit process? In addition to the streamlined process, there are a few other differences between Phase 2 and Phase 1 audits. For example, Phase 2 audits will be internally staffed, not conducted by third-party auditors. Covered entities will be asked to identify their business associates and provide current contact information. This will likely then trigger an audit for the named business associates, so if you are selected for an audit, you may want to give a heads up to your business associates so they can anticipate an audit as well. As noted before, Phase 2 audits will not include on-site visits unless resources will allow. In addition, auditors will not have an opportunity to seek additional information. So what you send them in response to the notice letter will be the basis for their audit. And finally, they will likely use a sampling methodology to seek sample responses within a limited time frame to determine compliance, such as requesting copies of the Notice of Privacy Practices given to the 10 most recently hired individuals. And we have, as part of our handout, some sample policies. Phase 2 audits, October 2014 through June 2015. The audits are slated to begin during this period, at which time OCR is targeting 232 providers, 109 health plans, and 9 clearinghouses. Their selection of covered entities is based upon a previously conducted survey. One additional difference from the Phase 1 audits is that not all entities will be audited for all areas. For example, only 33 health plans will be audited for privacy compliance. 31 health plans will be audited for breach notification compliance, and 45 health plans will be audited for security compliance. Now the audit will start with an audit letter containing a list of documents that must be produced. During Phase 1 audits, those documents include demographic information showing key personnel, such as the identity of privacy and security officers, and members of the firewall. Those are the people who can and do access PHI. Written policies and procedures, the covered entity's Notice of Privacy Practices, as well as other documents showing compliance with certain HIPAA privacy, security, and breach notification requirements. Once again, Phase 2 audits will be targeted to only one area of compliance, so the new notices are not likely to be as extensive. Now, the new HIPAA regulations, they were issued on January 17, 2013. And before we get into a deeper dive into the audit process, we want to drop a reminder that the new omnibus regulations were released in early 2013 that required covered entities to make changes to their notices of privacy practices, their policies and procedures, their forms, and their business associate agreements. Generally, those changes must have been made by September 23, 2013, with some exceptions. An auditor will likely also seek to make sure that notices, policies, procedures, and the like were timely updated. So last September 2013, you should have scrubbed up your Notice of Privacy Practices and policies. They will be the focus of an audit. Now I'd like to turn it over to Petula.
Thanks, Jeff. Let's shift now to some specifics. First, let's take a look at what an auditor will be looking for under the current protocols for the privacy regulations. Now, as Jeff mentioned earlier, what we're talking about today are the current protocols. We've been told that they're going to be updated for the Phase 2 audits, but as of late last week, the protocol still had not been updated. And we'll tell you a little bit later where you can find the protocols yourself. So one of the key areas an auditor will review are covered entities' written privacy policies and procedures. These tend to be more extensive than security policies and procedures simply because of the number of areas covered. Auditors will review the policies and procedures to make sure that not only that they cover areas required under the privacy regulations, but that they also comply with the law. So it's not enough just to have policies and procedures. They're going to want to make sure that your policies and procedures are compliant. The policies and procedures required for privacy are fairly extensive and take a while to cover, and I would truly bore you to death if we were to go over each one individually. So we're not going to attempt to cover them today. But you did receive some additional handouts, which has a list of the policies and procedures that will be included in an audit. So after the webinar, make sure you take a look at those. Now, and you'll find that they're kind of in a useful checklist format. An auditor will also look to see what policies and procedures are in place to mitigate any known harmful effects of a use or disclosure of PHI in violation of the covered entity's own policies and procedures. For example, the auditor will see if there are any procedures in place to notify the privacy officer of potential violations, as well as potential breaches. The auditor will look to see if there are policies and procedures in place for the privacy officer to take immediate steps to investigate any possible violations. Also, the auditor will seek to know if there are any policies and procedures in place to reduce any harm associated from a violation, such as steps to revise existing policies and procedures to prevent future violations from occurring. The auditor will also seek to determine if a system is in place to monitor for violations and whether policies and procedures are updated as necessary and communicated to workforce members. And when they say communicated to workforce members, what they'll be looking for is workforce member training on those particular items. And you'll see throughout the presentation we have that requirement about being communicated to workforce members. Just kind of translate that into, did you train them? During an audit, the auditor will also look to ensure that policies and procedures are in place to prevent a covered entity from intimidating, threatening, coercing, discriminating, or otherwise taking any retaliatory action against an individual who exercises a HIPAA right, such as requesting access to his or her PHI or participating in the filing of a complaint, either under the covered entity's own policies and procedures or with the Department of Health and Human Services. This will sound very familiar to you when you're accustomed to dealing with discrimination or harassment claims, which also have a prohibition against intimidating or retaliating for the filing of a claim. The auditor will also want to see evidence that the policies and procedures are updated at appropriate times and that the policy against retaliation or intimidation is communicated to workforce members. This means that the information about the policy should be included in annual HIPAA training. And just take a note there, I said annual HIPAA training. Yes, this does mean you should be training your folks who are within the firewall every year. So that's kind of a short and sweet drive through the audit protocol for privacy requirements. As you can see, there aren't actually too many elements to the privacy portion of the audit, but those elements have many subparts, such as requiring quite a number of written policies and procedures. And also, we would encourage you as a best practice to have forms that people can use, for example, to file a complaint, to respond to a complaint, to ask for an accounting of disclosures, et cetera, et cetera. Now that we've covered the audit protocol for the privacy regulations, let's turn to the security regulations. Security rule covers the administrative, technical, and physical security measures entities are required to take with regard to maintenance and transmission of electronic PHI. So the security rules only apply to what we call ePHI, or electronic PHI. Some of the measures are required, meaning that they're mandatory. Others are addressable, meaning that they are not mandatory, but a covered entity must document why it is not complying with that particular standard. The security rule applies to all electronic PHI. This includes electronic PHI received, accessed, or transmitted by laptops, mobile devices such as cell phones, USBs, CDs, external drives, desktops, tablets, and email, and whatever else Apple creates next week. The security rule has 5 categories of requirements: administrative safeguards, physical safeguards, technical safeguards, organizational requirements, and requirements for policies, procedures, and documentation. We will cover major aspects of each of these requirements. Now further, each category of requirements can be broken down into standards, and then those standards have implementation specifications, which can either be required or addressable. And if at this point in time your head is kind of spinning because of all that, Yeah, I did note that security was a little bit more complicated than privacy, so I feel like I kind of warned you. But when you start breaking it down, it's really not so hard to digest. It's just kind of a lot of lingo there. Now, if an implementation specification is required, entities, as I said earlier, must comply. However, unless specific guidance is issued, entities have flexibility in how best to implement the specification. And when determining how to implement a particular specification, entities should consider their own size, complexity, and capabilities, as well as their technical infrastructure, their hardware, and their software security. The probability of criticality or potential risk for the compromise of EPHI and the cost of security measures are also factors to consider. You know, for example, a large banking system will likely have a very sophisticated technical infrastructure, but a plant nursery may not. The Department of Health and Human Services does not expect that the nursery obtain the same hardware and software as the bank, so there is kind of a reasonable standard involved. If an implementation specification is addressable, an organization must decide whether the specification is reasonable and an appropriate safeguard for that entity. Note that if an organization determines that the specification is not reasonable or not appropriate, it simply must document why it was not reasonable and appropriate. And again, documentation is going to be crucial in the case of an audit, because remember, all they're going to be doing is reviewing your documents, and they're not going to have the ability to ask you any follow-up information. If it's reasonable and appropriate, an entity may implement a reasonable and appropriate alternative. But if there's an alternative that was not reasonable and appropriate, then the organization should document why it's not to be implemented and what the alternative is adopted. So really what you're kind of doing is leaving a paper trail of your consideration. Your organization must assign a security officer. Even if your organization has a fully insured plan and believes itself to be hands-off for purposes of the privacy rule, you cannot be hands-off for purposes of the security rule, and you must have a security officer. In addition, if you happen to outsource your IT structure, you still cannot outsource the privacy officer role. It actually has to be an employee of the organization that's sponsoring the health plan. You must appoint a person, not a committee or a group. And generally, this should be your highest-ranking IT professional or someone else within your IT group with extensive experience. This individual would be responsible for the development, implementation, monitoring, and communication of security policies and procedures. That would include making certain that appropriate workforce members are trained on security measures. As a best practice, your organization should also have a job description for the security officer. When audited, the auditor will ask for the name of the security officer and ask to see a written description of the security officer's assigned duties to make sure that the security officer's responsibilities have been clearly defined. So as a best practice, you'll want to actually create a job description for your security officer. Another required security measure is the requirement to conduct a periodic risk analysis. This is one of the #1 issues identified as a failure over the past few years during audits. Organizations must have written policies and procedures in place focusing on how to conduct an accurate assessment of potential risks and vulnerabilities to the confidentiality, integrity, and availability of EPHI. This means that the policies and procedures should identify all assets and information systems that create, receive, transmit, or maintain EPHI. Now, when I say assets, what I'm talking about are computers, mobile devices like cell phones, tablet computers such as iPads, USB storage devices, copiers, etc. And then information systems means the software that you have. If you're audited, the auditor will look to review records to determine if periodic risk assessments have been conducted, whether all assets and information systems that contain, possess, or transmit EPHI have been identified, and whether the risk assessment process has been updated to reflect any changes in your organizational environment, such as when you start to use a new email system or you purchase some new servers. So as you can probably gather from that, you don't just conduct a risk assessment one time and you're done with it. it should be at least an annual practice. One required security measure is the requirement to conduct a periodic risk assessment, as I said. And when that happens, the auditor is going to be looking for the documentation. So make sure, again, that you have your documentation in place. Now, at the core of a risk analysis are the following questions. Have you identified the EPHI within your organization? Now, this includes EPHI that you create, receive, maintain, or transmit. So you have to think about, oh, I work with a third-party administrator, and we receive documents that are emailed that contain PHI. Or we have a third-party cover administrator. We send them EPHI all the time. Or perhaps you have an organization that creates benefit statements for you, and that would also be a flow of EPHI. Second question is, what are the external sources of EPHI? For example, do vendors or consultants create, receive, maintain, or transmit EPHI on behalf of your health plan? And then third, what are the human, natural, and environmental threats to the information systems that contain your plan's EPHI? So do you have employee issues that you might have to think about, or are there external threats, like perhaps recently your IT system may have been hacked? An organization must have a process in place also for selecting IT systems and services. Those policies and procedures should include consideration of the following. 1, application of the IT solution to the intended environment. In other words, are you using the right software for the right thing? 2, the sensitivity of the data involved. You know, if it's just an employee's name, that doesn't need as much protection as the employee's name, Social Security number, and a claim dollar amount. Third, the organization's existing security policies, procedures, and standards. In other words, do you already have security measures in place that you can then pull over and use for your health plan too? And then fourth, other requirements such as resources available for operations, maintenance, and training. One key thing that will be to identify who will conduct any necessary review and analysis. You're definitely going to want the folks from IT and your security officer to have the primary responsibility. You may not want it to be just one person. You may want it to actually be a group. Your organization will also want to define which acquisitions require advance approval, such as when there are changes to your networks or technology is purchased as part of a major improvement. You'll also want to have processes in place for the approval of vendors selections, so our consulting agreements or development plans or their contract documents when developing or purchasing new in-house systems. And your procedures should indicate what information must be provided and to whom in order to obtain approval. So you want to have a clear approval path in place for your IT systems and services. And certainly you may already have some in place for your organization as a whole, and what you're going to want to do is adopt those and make sure you have them in place for your health plan. In case of an audit, the auditor will want to review your written IT systems and services acquisition policies and procedures and determine whether those policies and procedures are approved and updated on a periodic basis. So once again, the documentation is key. An organization must also have procedures in place to conduct a periodic review of information systems activity. And that basically is looking to see who's trying to get in to see the EPHI you have. The information system activity review enables covered entities to determine if any EPHI is used or disclosed in an inappropriate manner. For example, you've defined who is within your firewall, and if you see that someone from outside of the firewall or even outside of your organization has been trying to obtain information in a file that contains EPHI, then you know you've got something that's inappropriate happening. And system activity review includes things that are called audit logs or access logs or reports, security incident reports, and other reviews of when the files, again, were accessed and by whom. Now, there's no universal recommendation for the scope and frequency of information system activity review. In other words, there's no hard and fast rule that you have to do it every month or every week or every day. But logs and reports concerning information systems with higher risk and or higher criticality, should be reviewed more often. For example, unusual failed login attempts should be detected and follow up on in a few days, not a few weeks. On the other hand, lower risk activities such as browsing the web where firewalls and antivirus software are both present may require a less frequent review. But as a general rule, if something merits logging, it should be reviewed no less frequently than at a 90-day interval. So although there's no hard and fast rule, there's kind of a best practice of at least 90-day reviews. And you definitely want to make sure that the log reviewers are different individuals than the individuals whose activity is being tracked by the log. So you want to check and balance there. Now, a question arises over how long to keep the logs. The general HIPAA record retention policy is 6 years. But that does not necessarily mean that you must keep the underlying data for an audited log for 6 years. But it does suggest that at a minimum, you should retain a record of the activity or assessment. For example, if you, at a minimum, you should record a record of, let me try that again for you folks. If there's an internet server log and it's reviewed each month, then you're going to want to make a contemporaneous, meaning at the same time, record of the review. You could even have a little checklist and initial it and then put down a date every time the log is reviewed. And that should be sufficient for you to retain for the 6 years. However, you may want to keep more recent documents, maybe the underlying data for the most recent 6 months, and then just keep the summary logs after that. An auditor will review any written policies and procedures for reviewing information system activity and ask for a sample of documents showing that the reviews have actually been conducted. For example, the auditor may ask to see a sample audit log or a sample access report. The auditor will also look to see if policies and procedures are approved and updated periodically. This means that you should have a procedure to establish a periodic review. Now, maybe you write in there that you're going to do it every 6 months or so. And then you should make sure that your policies and procedures are actually updated. Also during an audit, an auditor will seek to determine if your organization has implemented proper security measures to reduce the risk of security threats. Now what you do here will be based upon that risk analysis that we talked about a few steps ago. An auditor will review your written security policies and procedures to determine whether security measures are sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level. And I want to emphasize this idea of reasonable and appropriate level, because truly if you complied to the nth degree with everything that the security provisions say, you would freeze all your ePHI. In other words, you wouldn't be able to send PHI anywhere because you've over-encrypted and you have done this, that, and the other thing. So there's a reasonableness standard in the safety precautions that you have to take. So during an audit, the auditor will also review your security policies to determine whether security measures are sufficient. And I'm sorry, I think I already told you all that. For this particular specification, the auditor is going to make sure that you have created policies and procedures for the authorization and or supervision of your workforce members. In other words, they want to make sure that you're not letting just anybody handle your PHI. And they're going to look to see that you have some measures in place to have somebody who oversees whether certain people should have access to PHI. And what I'd like to do, and I kind of think is a best practice, is that you kind of create a gigantic chart that lists the different people who could have access to ePHI, and you document a decision about what level of PHI they're going to have contact with. So some people will have none, some people will have limited, and some people will have full access. And during an audit, the auditor is going to be looking for any formal documentation of the policies and procedures that you've used to determine the level of access. And if the organization chooses not to implement the standard, the auditor will seek documentation of the reasons for not fully implementing. So as you'll notice, this particular standard is addressable. So you don't necessarily have to do it, but it is a good practice to do it. Now, if you don't do it, make sure you write down why you didn't do it. Another addressable specification is the implementation of policies and procedures to ensure appropriate access to ePHI by establishing criteria for hiring and assigning tasks. Essentially, this is the creation of a process to determine who should have access to ePHI based on job duty. And is also going to see whether you have taken steps to make sure that the folks who have access to PHI on behalf of your organization are trustworthy. You know, did you do a background check to make sure that they haven't been convicted of any felonies that involving fraud or something that, you know, would deal with some sort of untrustworthiness? Have you made sure that they actually have the qualifications to do the job that you're talking about? That's sort of what they're looking for. Again, this is addressable, so if you choose not to do it, document why you're not doing it. And doing an audit, the auditor will also seek information to demonstrate that workforce members with access to ePHI have the necessary knowledge, skills, and abilities to perform their job duties. So this goes back to making sure that the people that you hired for the positions actually have the qualifications for the positions. And then the final addressable that we'll talk about, it deals with the determination as to whether an individual has an appropriate level of access to ePHI. The clearance process must establish the procedures to verify that a workforce member does in fact have the appropriate access for their job function. You know, for example, if you have individuals in payroll, they need to know what deductions should be taken from paychecks. However, they don't need access to actual claims that are administered under the health plan. So you have to be kind of careful with the level of access that you provide. So during an audit, the auditor is going to seek written policies and procedures and evidence that the procedures to approve or verify the appropriate levels of access have been followed. Again, I like to use that big checklist that has the level of access. You know, maybe you put the job position on there, and you know that kind of helps you document what it is. And with kind of that walk through the privacy and security, Jeff, if you don't mind, I'll turn it back over to you for the audit protocols for breach notification.
All right, now that you've totally immersed yourself in the impenetrable complexity of all this, I'm going to make it even more complex. Breach notification. We have the breach notification rules and what auditors will be looking at, and we'll call it the wall of shame. It's posted on the OCR website. So that's the header for this particular topic. What is a breach? A breach is an unauthorized acquisition, access, or use or disclosure of unsecured, underline that, unsecured protected health information in a manner not permitted by the breach regulations, which compromises the security or privacy of that information. Now, unsecured means that the information was not destroyed or otherwise rendered unusable, or, for example, which, by the way, would mean encrypted. Note that not every disclosure, even if it is unintended, is a breach. There are several exceptions, but these are beyond the scope of our presentation. I will mention a couple. Unintentional use by a workforce member, all within the scope of their authority and acting in good faith. Inadvertent disclosure from one authorized person to another, again within the covered entity. And a disclosure with good faith belief that the unauthorized recipient would not readily retain it. And these are obviously very subjective in many ways, but those are giving an example of some of the exceptions. Now, breach notification. Breach, as we described, is a disclosure, use, or access in a manner not permitted under the notification regulations. And now, an auditor will therefore ask, if the risk assessment process exists to determine whether a breach exists. Thus, a plan sponsor should have written policies and procedures to address how to determine if a breach has occurred. Now here we're assuming the plan sponsor is handling PHI. And as we'll get into a discussion of pools and pool participants, you'll see that that's pool participants may not fit that category for HIPAA purposes. Breach notification. Noticed individuals. If a breach has occurred, a covered entity must notify each impacted individual whose unsecured PHI has been or is reasonably believed to have been used, accessed, acquired, or disclosed as a result of the breach. You therefore must have policies and procedures as well as forms in place in case of a breach. The auditor is going to ask you for a copy of those policies and procedures as well as your breach notification forms. Now, timeliness of notification. A covered entity is required to provide notice without unreasonable delay, but in no case no later than 60 days after discovering the breach. In cases involving a breach by a business associate, the 60-day period begins to run from the date the business associate discovers the breach, not when the business associate tells you of the breach. The auditor will seek written policies and procedures for handling notifications and will want to verify that the correct timelines were met in case of any actual breaches. Methods of individual notification. Here we get very 20th century. In case of a breach, written notification is required. Generally speaking, that means by mail to an impacted individual. But where there are additional methods for individuals who cannot be located or for deceased individuals. The auditor will want to have documentation of your process to provide that notice. This should be covered in written policies and procedures again, and they'll be looking for them. Now, email. Affirmative consent of recipients is required for electronic notification. My recommendation is that you do both, regular and electronic mail, for these notifications. You also need to look at applicable state laws for breach notification procedures and the content of notices, because they usually overlap, and indeed sometimes they're even more they're stricter than what HIPAA would require. The content of the notification. This slide pretty well spells it out, but those your organization should have a notification sample forms to ensure that none of these elements are missing. As you can see them here. Next, we have the content of the notification. The auditor will ask for any template or form letter your organization has to provide those breach notifications. And if you've had any breaches, the auditor will also ask for documentation that those forms or templates were actually used. Now let's turn, if we can, to the impact on health pools and their participants. I've had a number of conference calls with members of our advisory group, of which Petula is a critical member, in which we discuss the ramifications of HIPAA compliance requirements as they apply to pools and pool participants. I think the consensus seems to be that pools are covered entities in the health plan. The TPAs, such as our, in my case, Aetna, is the business associate. The participants are generally speaking considered to be plan sponsors and therefore not business associates. Keep in mind that we bend over backwards not to disclose PHI to our participating employers. The PHI that they otherwise acquire in their function as an employer would not be at risk or not be subject to the HIPAA requirements until they're disclosed to the plan or the plan discloses that information to them. How is PHI handled? Typically, in handling PHI, you have the enrollment process, COBRA administration, wellness programs, coverage appeals, claims handling and benefit plan inquiries, and large claims data. All of this means that, especially at the pool level, if you're handling PHI, you've got to meet all the HIPAA security requirements, and your IT infrastructure has to be up to snuff. Now, the enrollment process, what we're doing, by the way, in response to the Affordable Care Act information reporting requirements, we're going to advise our pool participating employers to accumulate, capture, and retain the enrollment information about their employees and their dependents so that they have it in there, and to retain it for further use and disclosure on these information returns which they must submit. The pool, as a pool, we will help them verify the accuracy of that information and also assist in the verification of the month-by-month enrollment information that must be disclosed for each plan, for each responsible individual. If you've got an employee, you need to be able to disclose during what months they were covered, and as well as their dependents. All this information would be hopefully captured initially in the enrollment process, but on an ongoing basis, I think it's fair to say that the pool participant will have better access to the information sooner than the pool will, although you have to work out protocols with the pool, with your pool participants, so as to ensure the proper handling of PHI. So you don't want to be in a position where your pool participants are at risk for any HIPAA compliance issues. And now we'll turn it over to Petula for practice pointers, and then we'll take some questions.
Well, I think we've probably created a little bit of nervousness because we've used the word audit so often, but let's change direction a little bit and talk about a few practice pointers to make you feel a little bit less nervous. I mean, first, this new round of audits is going to have specific focuses in 3 parts. So, for example, the first round, as Jeff had previously mentioned, either you'll have a privacy audit, a security audit, or a breach notification audit. They've told us that people aren't going to be subject to all 3 like they were in the Phase 1 audits. But if you get chosen for one of those types, they're going to have certain key things that they're looking at. So, for example, if you're chosen for a security audit, they're going to be looking for that risk analysis and that risk management. So did you do that risk analysis, and then did you take steps to reduce the risk that you identified? If you get chosen for a breach notification audit, they're really going to be looking at the content and timeliness of notifications. Hopefully, none of you have experienced any breaches, so that's an easy one, and you just have to show them your forms and your policies and procedures. If you're chosen for a privacy audit, then they're going to be looking at notice and access. Now, the privacy notice is really what they're talking about, and access pertains a lot more to healthcare providers than health plans, because that's where they've seen trouble, where people are asking to get a copy of their medical file, and it's taken 6 months to get a copy of it. That's really not such a big deal in the health plan arena, so we're at less risk for that kind of audit failure. Then there's supposed to be a second round of Phase 2 that is to occur later in 2015. And that time, they're going to focus in on security, in particular devices and media controls and transmission security. We think that one of the key things they'll be focusing on are BYOD, bring your own device. For example, a lot of folks will receive their work email on a private cell phone, and they'll be looking to see what kind of security measures are in place. And when you start looking at cell phones, they have different levels of innate protection. For example, it's my understanding that iPhones have their own encryption, but maybe Samsung Galaxies don't have a device encryption. So you would have to add some sort of app to include encryption for that particular phone. Then for privacy, they're going to be looking more toward, kind of the safeguards you have in place, and then training to see that you've got your written policies and procedures, but also that you're training people on those policies and procedures. And then there's slated to be a different round projected for 2016, where they're going to be looking more at security, encryption and decryption, which are addressable issues, but are probably less addressable now than they used to be, because encryption and decryption are much easier, and the different software speaks to each other better. Now, if you're chosen for an audit, please, contact any consultants that you have, any legal counsel that you have that might be in employee benefits, or if you have counsel like Jeff, you certainly want to pull him into the loop and make sure that you have a powwow. We, as a best practice, recommend providing the documents in sort of this tabbed and labeled binder. And what you would do is you take the audit data request and you copy down all those things, and for a response you say see tab A, and then the next one you say see tab B, and then maybe the next one will say see tabs A, B, and F, that sort of thing. Make sure that if you do get an audit letter that you contact your vendors, your third-party administrators, maybe your COBRA administrator. Make sure that you've got all the documentation you need from them too. And then if they happen to get the funding, you want to make sure that anybody who's going to be part of an on-site visit, that those folks are available for interviews, because it would be bad to not have your folks available for interview and have an auditor show up. And they will warn you if they're going to come and do an on-site visit. Oh, and going back to actually responding to the data request, you may have some things where you don't actually have something in place or it doesn't apply to your organization, and you'll want to get your consultant or your legal advisor to help you kind of come up with what we call a narrative response. And then finally, we want to make sure we treat the auditors with courtesy. And one of the things that we've been warned about in all of this is that if you are discourteous to an auditor, then you may find yourself in one of those compliance reviews rather than this general educational audit. And that takes us to some very helpful resources. You can see the links, and they'll be available in your handout, to the different OCR pages. They have a lot of assistance in there, a lot of guidance, a lot of explanation. They have the protocols on those pages, and it truly is one of the more helpful pages I've seen on this particular topic. Now, that brings us to the end of our prepared remarks, and we hope that you found the webinar to be helpful. We thank you for your time and attention, and I'm going to turn it back over to Jenny to see if we have any questions.
Great. Thank you, Petula and Jeff. There's a couple questions that have come in, and I'll address those and see if others come in along the way. The first is just some clarification from if a pool only covers workers' compensation, but obviously interacts with other covered entities because they seek medical data for the claim and so forth. How should they view themselves in terms of their role as a covered entity or a business associate or whatever, and how do they approach their role in this process?
Petula, this is Jeff. Why don't you take a first shot at that one?
Okay. In most places, workers' compensation is not considered to be a health plan. I think one of the exceptions could be Texas, because it's a non-subscriber state where you could opt out, in which case if you have non-subscriber workers' comp, they think that that could very well be considered a health plan under HIPAA. Otherwise, the general rule is that workers' compensation is not a health plan. Therefore, sponsoring a workers' compensation pool should not make you a covered entity. So there's that one part. Then the other part is that a health plan itself cannot provide information to a workers' comp plan without an authorization from the individual whose information is being transferred. So if you are trying to coordinate with a health plan, there really should be a written authorization in place to enable the information to come from the health plan to you. Now, if you're sending information from the workers' comp plan to the health plan, that's not covered by HIPAA, so you don't have to have a written authorization. I know that may sound a little confusing, but it kind of just depends on which direction the information is going. It comes from the health plan to workers' comp. There should be a written authorization from the individual whose medical information is at issue.
By the way, we have both a workers' comp and a health trust, and we have, whenever we have any PHI being transmitted from one or the other, we routinely have the individuals sign a HIPAA authorization. Just a little belt and suspenders, just so we don't get into any question as to what was appropriate and whether or not the individual knew the information would be shared.
Okay. And another somewhat related question, only even expanding it to even a property casualty insurer, if, you may be seeking for an auto claim or a liability claim, you may be turning to a covered entity, the hospital or the providers, to get information. So they're covered entities. Are you technically then, is the pool, the claims handler or the pool a business associate, and does HIPAA apply then?
The pool's not going to, oh, go ahead.
Go ahead. Yeah, I wouldn't think they'd be a business associate.
Jeff, you're saying that you don't see the pool that
as a business associate in that scenario, no.
Okay. Okay.
I would agree.
Okay.
But however, because you're trying to get the information from a provider who is a covered entity, they need a written authorization to give you the information. Right. And then when it comes into your hands, yeah.
Okay. So the tradition of getting the written authorization is sort of the way that's addressed, rather than under HIPAA. again, anyone who has any other questions, just type them in the box, and we'll pass them around. I did want to note also that listening to this and thinking about all the interest that pools have in cyber risk in general, management of financial data and personal information from a cyber risk perspective that might not be health related at all. It seems to me that there's an awful lot of sort of good practice, good risk management practice that some of these protocols you could borrow from when you're thinking about how you're managing other electronic data, even if it's not health data. Maybe I'm just trying to make lemons out of lemonade, or lemonade out of lemons, but certainly the language in the protocols is good cyber risk management for any kind of data that you handle.
Sure. In fact, for encryption purposes, they have the National Information Standards for Technology that are referenced for HIPAA encryption, so that encryption standard and related standards could easily be applied to the protection of other data.
Okay. And one other question, just to clarify, for a pool that, regardless of whether they are a health plan for their members, pools are always looking to be risk management advisors to their members, and their members are all plan sponsors. So there seems to be some information in here that a pool might want to pull out and share with its members because they are plan sponsors, in terms of making sure they're aware of their role as a health plan sponsor, not necessarily a covered entity, but a plan sponsor. Am I reading that right, Jeff?
Yes, you would want to advise them of that, and we've done it. We focused on their role as plan sponsors under the Affordable Care Act and various alerts that we've sent to our pool participants.
Right.
And you can, well, I've had discussions at length with some folk about whether a plan participant is whether a pool participant is a plan sponsor for this or that purpose under the ACA. I think the IRS, oddly enough, exercises more common sense in this area than HHS has. Won't get into the details, but the whole point here is to be consistent. In my judgment, you want to preserve the status of the pool participant. Each pool participant is a plan sponsor in your health trust, and you also want to maintain their self-funded status. As you, Jenny, and I both know from our appearance before the IRS, that is an important feature of pooling, even if they're self-funded on a pooled basis. And it relieves them of a lot of other regulatory burdens that they otherwise would be subjected to. Okay.
Well, our 60 minutes allotment is up, and I don't see other questions pouring in. There's a lot which I think is not testament to, I think it's a testament to the excellence of the material and also the follow-on resources. This webinar.
And credit goes to Petula, by the way, for the materials. She did a superb job.
And I do want to specifically recognize not just Petula, but Arthur Gallagher. We discovered Petula through Gallagher, which is one of the Quality Education Initiative partners of AGRIP, and she has jumped in with both feet to be an extremely helpful resource to us. This webinar has been recorded and will get posted on the AGRIP website for anyone who heard comment that went beyond what's written on the page and wants to go back and hear it or share it with others. The email went out separately with other resources. If anyone didn't get it, Jessica Tripoli can provide it to you. And both Jeff and Petula's contact information is also available on the slides, but you all know how to reach AGRIP as well. So if any issues or questions come up, don't hesitate to contact us, share thoughts or information, and we'll continue I did get one more question. I'm going to grab it real quick while it's here. Wouldn't the release of health plan claims to a work comp department fall under TPO for coordination of benefits? I'm not sure what that means.
It wouldn't, because the workers' comp plan is not a health plan.
Okay.
So if it were a health plan, if you were talking about medical and dental, then it could fall under TPO. But because workers' comp is a non-health plan benefit, it wouldn't. But that's a good point that in other cases it certainly could.
Right, but in the case of a work comp carrier, it doesn't.
No.
And this may be a question to follow up on because the comment says that this is what they were advised by their attorney. So I know that the question has come up a lot of times. You're dealing with health information. Treating it carefully is always good practice, whether you're required by HIPAA to do so or not.
Well, I think what we've done, just so the questioner understands, that we've executed routinely have the individual employee, injured employee, execute a HIPAA authorization form.
Okay. So you do that even under workers' comp, Jeff?
Yes. Oh,
okay.
Yeah. And we do that because we're going to be getting medical information, and we provide HIPAA authorization form signed by the employee to the healthcare providers. So we button down, the employee knows exactly where their information is going and the purpose for which it's being used. And they're very sensitive, especially police, to make sure that for workers' comp purposes, the health trust doesn't disclose information to the workers' comp trust that might somehow compromise their workers' compensation claims, such as the existence of pre-existing conditions and the like. Okay. But we routinely have HIPAA authorization forms executed in all those situations just to protect our flanks.
Okay, as you said, belt and suspenders. Okay, right. Again, thanks very much to Jeff and the Delaware Valley Health Trust for loaning him to us, and Petula and Gallagher for loaning her to us. Thanks to all of you for participating, and we hope to see you on the next webinar. Thank you.
Thanks, Jenny. Take care.
Thank you.